Good morning. It's a pleasure to be with you this morning. I want to express my thanks and appreciation to the SMA for inviting me to speak this morning. I also want to thank Dr. Shannon and Dr. Padiachi for having not only me here today, but also for the opportunity last night to meet with the board and to enjoy a bit of hospitality last evening. It is my great pleasure and honor to be the Minister of Health. As you can imagine, it is a big job. I've been in the position for just a few months. And last night, a lot of the doctors that I had the opportunity to meet last night asked, so they were saying things like, it must be a steep learning curve. And my answer to that is always no, it's not a curve, it's just a straight incline. I've likened it to trying to drink water from a fire hose. My intent in the early goings as being minister is to be a little bit like the duck that you might see on the lake. That things on the surface may seem pretty calm, but you can tell that under the water it's a whole different story. Saskatchewan is a growing province, and our people have tremendous confidence in their ability to shape the future. The people of Saskatchewan and the people who make up the health system, I believe, were very well served by Don McMorris over the last 5 years as health minister. He took his role seriously, delved deeply into the issues, and communicated clearly and consistently about challenges and the priorities that we all face. I have tried to take a similar approach with my previous roles as a minister, so even though I have some priorities of my own, don't expect a sudden or dramatic shift in overall direction. And you must know, as you probably do, that the Premier is also taking an active role in shaping the transformation agenda of the healthcare system. A commitment that he reiterated just a few weeks ago with the government's growth plan. So there is definite continuity in the health portfolio. Minister McMorris certainly leaves large shoes to fill, and I look forward to continuing the tremendous work that he and our health partners, including the SMA, have so ably undertaken. I also want to mention briefly that I have been so much benefited by being able to count on somebody like Randy Weeks, who is taking on the role of Minister of Rural and Remote Health. And I know that many of you had the opportunity to meet with him last night. Since his appointment, Minister Weeks has visited more than 40 communities across the province to hear from doctors and other providers and from community members. And he has more visits planned. Now, during the past 5 years, we've seen tremendous change and progress in our health system and in the relationship between the Ministry of Health and the Saskatchewan Medical Association. The SMA and our government share many of the same goals. We both have a strong commitment to putting patients first and to work towards a high-performing healthcare system. The SMA has been and continues to be an important partner in bringing about the transformation that we're seeing in our health system. You've been instrumental in helping us achieve many successes. We value the work that you do, and we've demonstrated that, I believe, in a number of ways. To address the shortage of physicians, we've developed the physician strategy. We've launched a number of initiatives that have flown from it. For example, we've established the Physician Recruitment Agency, recognizing, yes, that our homegrown medical grads are key to this plan. We've committed funding to distributive education to better prepare graduates to practice in rural Saskatchewan. And we've developed a new Made in Saskatchewan assessment process for internationally trained physicians, knowing full well that more work needs to take place. Recruiting physicians is critically important, but just as important is retaining the ones that we already have by making things better for our existing physicians. As a result, the physician strategy focuses on making sure that we offer physicians competitive compensation and an attractive workplace environment. And I believe that our current agreement has resulted in Saskatchewan having one of the best physician compensation rates in Canada. Things are starting to turn around. Today, over 200 more physicians are practicing in Saskatchewan than just 5 years ago. And while the number of physicians practicing in Saskatchewan is increasing and physician turnover overall is decreasing, we recognize that more work needs to be done, particularly in rural and remote areas of this province. We've seen other big improvements as well. For example, there are more nurses in Saskatchewan and more training seats for both doctors and nurses. Wait times for surgeries are shorter. The Saskatchewan Surgical Initiative faced some daunting challenges but has made remarkable progress, and I was very encouraged last night to have encouragement from physicians to keep this work up. Today with the health system, we are setting a goal to be able to be in a position to offer Saskatchewan residents the offer of surgery within 3 months, no later than March of 2014. And we are on track with that target. Physicians, of course, have been and continue to be a vital part of this success. We are also focusing on strengthening our primary healthcare system. As a result, we've worked with patients, communities, health system leaders, healthcare providers, including physicians, to develop a framework for strengthening primary health care. Released this past spring, the framework is a roadmap for a primary healthcare system that is patient-centered, community-designed, and team-delivered. It's one that will make better use of a full range of health professionals working to a full scope of practice with a physician as a key team member. We know that working on a team with other health providers is also designed to give doctors a better work-life balance, ultimately reducing stress and burnout. And physicians have been key in developing this framework. We are also excited to see the potential of an idea that Minister Weeks studied in Nova Scotia, as you will know, called the Collaborative Emergency Centres. We think that it could augment and be a key part of primary health care in rural and remote areas of this province. Improving the predictability of service and access to care for patients is our goal. It is our intent that this model will also improve the quality of life for our rural doctors by alleviating their often rigorous on-call schedules. But it is not about replacing doctors. We've also seen some phenomenal success and progress using lean methodology as a way to improve safety, maximize our resources, and adopt best practices in a consistent, sustainable way. To date, our health regions have launched hundreds of lean initiatives focused on improving a wide range of programs and services. Doctors have participated in many of these successful initiatives, and a good example is the planning for the new Children's Hospital in Saskatoon. I can tell you that physicians were directly involved with healthcare providers and patients' families, working side by side to achieve better workflows, safer procedures, and an environment that helps patients and their families experience less stress about being in a hospital. The key to this success into a high-performing health system is and will continue to be strong physician engagement. Last night I was asked, what is the number one role that physicians can play in this process? And the answer, and I totally agree with this, is leadership. As we continue transforming our health system, physicians have an even greater leadership role that they can play. You are leaders in the system. You have a great ability to accelerate change and to influence that change. We have seen how this positive influence has enhanced efforts to promote care and achieve goals and targets. Physician engagement and leadership will continue to be vital in transforming our healthcare system. Our government is committed to improving access to a healthcare system that provides better health, better care, better value, and better teams. As we move forward on our transformation agenda in healthcare, we will be guided by our commitment to always putting the patient first, a commitment that I know is shared by physicians across Saskatchewan. That agenda includes targets and innovations to improve access and health system quality in areas like emergency room waits, complex care, mental health, and safety and quality. Physicians will play a major role in all of these initiatives. Now, these targets are not achievable in just 1 or 2 years. They are transformational, and they will take the collaborative effort of the entire healthcare system and our partners, including the physicians, to achieve them. There are 5 areas where we're working towards breakthrough this year, and I've talked about several of them, but they include transforming the surgical patient experience, strengthening patient-centered primary health care. We are deploying provincial continuous improvement or lean management system. We're holding more than 1,000 quality improvement events, which are involving frontline staff, physicians, and patients to improve the patient experience and reducing errors. We are focusing on patient and staff safety. Tools will be provided to physicians and healthcare providers to ensure that lean becomes embedded within our healthcare system. And our final breakthrough this year, identifying and providing services collectively through a shared services organization, namely 3S Health. This fall, we started system-wide planning to identify targets for next year, and I'm very pleased that the SMA accepted our invitation and joined the planning process. Again, I can't stress enough the importance that the role of the physician plays within this healthcare system. Your engagement and your leadership on all levels, including matters of provincial priority, are critical. Minister Weeks and I, in closing, look forward to working with all of you on a continued transformation of the health system for the good of all the people that we serve together. Please accept my heartfelt gratitude for the partnership and for the working relationship that we're able to build even in the early months of being Minister of Health. I look forward as I've said last night to some of the members that we met with, for however short or long of time the Premier allows me to be the Health Minister. I am just so grateful for this opportunity to be a part of this system, to be a part of the transformation of the system, and to working with all of you.